Hi, everyone. Lisa White, IVF fertility coach, author of Hold On Baby, and the creator of IVF Manifesting a Miracle. I'm here with our friend, Dr. Greene of Conceptions.
Hey,
How are you, Dr. Greene?
I'm doing great. How are you doing?
I'm great. I'm great. You know, we had a topic planned for our clinical conversation. And then after just chatting briefly, we decided, you know what? The topic related to COVID is kind of pressing right now. And I would love for your insight and
Yeah, well, let's just start
knowledge.
with a little bit of perspective of why this is important.
Yeah.
Last week there were more new cases of COVID reported in the United States than a year ago during the same week. And that's kind of shocking, especially when you consider that a large percentage of the population is vaccinated today.
Yeah.
Now, just to put it in perspective, this does not mean that vaccinations don't work, because the vaccinations do work. Over 90% of hospitalizations and 99% of deaths are in people that have not been vaccinated. So the vaccine is working at keeping people out of hospital. But it is an infection that's continuing to circulate. It is one that's still making people sick. Now we're seeing more young children sick because they aren't able to get vaccinated. Mm-hmm. And we're just heading into return to school. Mm-hmm. And it's anticipated because of both the change in season and heading back to school that this current spike, and again, some people are calling this the fourth spike, might last for at least 4 to 6 weeks, and that would basically be well into October. And I just think it's tragic, and I think it's just helpful that we update people, that we provide detailed information, we continue to respect their choices, but at the same time, just put things in perspective in terms of what we know and what we don't know today related to COVID vaccination, particularly as it relates to reproductive medicine and fertility, which is obviously the focus of our discussion.
Right. I know it's something on a lot of people's minds. A lot of people are going through fertility treatments right now. It's a very uncertain time, right? Who knew we would still be in this place, right? With COVID, and it's even worse, like you said, than it was a year ago today. It's really scary.
Well, exactly. And the thing that's important is too many people actually falsely believe that they should wait and get vaccinated either after they're pregnant or after their fertility treatment is started. Mm-hmm. And the absolute opposite is true. I've literally had patients ask me for exemptions to getting vaccination based on the fact they're going through fertility treatment. I tell them I can't do that. All of the organizations that monitor the safety data, which includes American College of OBGYN, American Society for Reproductive Medicine, CDC, the American Medical Association, even the American Academy of Pediatrics are recommending that women get vaccinated, preferably before they're pregnant, definitely if they are pregnant, and even if they're breastfeeding. And one of the things that I don't think enough people realize is that by getting vaccinated before pregnancy or while breastfeeding, women are not only protecting themselves, they're protecting their child as well, because there's no plan to immunize young infants with, against COVID. And obviously they can't wear masks. And so the only protection they can get is through what we call passive immunization through mom, which is mom getting vaccinated and passing antibodies either across the placenta or through breast milk.
And you're the data guy, so I know people are hesitant to get the vaccine early on, wanting more data. Do you see more data coming out?
And that's the irony to all of this, Lisa, is we have more data on this vaccine than almost any other vaccine that's ever been used. The difference is vaccines like flu and chickenpox or HPV, you get data that drips in over 5 or 10 or 15 years. Because of the severity of the pandemic and how rapidly these vaccines have been done, we've actually had more data collected on these vaccines over the short period of time than we have in other vaccines that have been around and used for many years. And it's overwhelmingly safe. It's not perfect. I still am recommending to my patients that they go with the mRNA vaccines, either Moderna or Pfizer, because they seem to be safer and marginally more effective than the Johnson and Johnson vaccine.
And safer.
That's not just
safer.
Yeah, exactly.
Safer.
Well,
how is it safer?
Well, basically, the J&J vaccine is the one that is the more traditional vaccine. It has a lower success rate for providing immunization.
Okay.
It has also been associated with some rare cases of something called Guillain-Barré syndrome, which is a facial paralysis. And it has also been associated with rare blood clotting issues in reproductive age women. Now, the fact that our target audience is reproductive age women, I say, you know what? Save that vaccine for older men like me, or people that don't want to use the mRNA ones. But the mRNA vaccines don't have any of those issues. And I'll give you an example. I had a patient recently that told me that her doctor told her she shouldn't put anything in her body, that beyond what she's putting in her body for the fertility treatment, because she's already doing so much. I said, if that were the case, you need to stop eating. And she said, what do you mean? I said, well, when you eat, you're basically putting foreign things in your body that are getting absorbed. And I said, I explained to this patient that the mRNA vaccines are cleared from your body in less than 48 hours, which is actually less time than it takes to clear an average dinner. And so the point is, the mRNA vaccines, the reason they have to be so refrigerated at such low temperatures is that they're cleared very quickly. They're not as stable. And so that actually adds to their safety profile. They're only present long enough to set the immune response in motion to start building up the protection. And then they're out of the body. So you can't have some delayed symptoms weeks or months later. It's gone. It's not in your body anymore.
Wow. Yeah, I mean, you understand this way better than I do. I don't know. There's just people of all different sides and beliefs, as you and I have talked about. Some believe.
Well, and one of the funny things about beliefs, and I saw a brilliant bumper sticker that said, the beautiful thing about science is it's true even when you don't believe in it. And the point is, if someone doesn't want to do a vaccine because of their belief, I respect that. But if someone doesn't want to do it because someone told them it was harmful, where's the data for that? And in the absence of data, we shouldn't be saying things like that. And anytime somebody does say something like that, we should all feel comfortable saying, where's the data on that? Where did that come from? And in the absence of data, we shouldn't be, trying to convince people of what they should or shouldn't do just based out of a theory or out of a fear that is usually completely unfounded.
Can I ask you, so your clients, if they have an egg retrieval coming up or a transfer coming up and they're not vaccinated, and are there different protocols you do? I mean, obviously wearing a mask.
Absolutely. I mean, keep in mind, we are dealing with a respiratory virus. And even though most people that have they catch COVID have pretty mild symptoms, which is some people's justification for why they don't want to get a vaccine. If you have any sort of respiratory symptoms, an elective procedure like an egg retrieval is supposed to be canceled. And so for people that say that they don't want to get vaccinated before their procedure, I say, I respect your belief. I respect your decision. Please don't be disappointed if we have to cancel your egg retrieval. Because as I mentioned at the beginning of our discussion today, Lisa, we're getting exposed to this more and more. And even people that have been vaccinated are sometimes getting symptomatic. And so, if you're not going to get vaccinated, at least keep wearing a mask. If you're not going to wear a mask, realize you're taking a risk, and that might, impact whether or not your treatment is going to need to be interrupted.
Any little extra tips you can give for us to boost and build our immune systems and keep us strong during this time? I don't know.
Well, it's funny that you asked that there are some things that have been shown to be helpful. Getting adequate vitamin D, this is part of what's called the Johns Hopkins protocol, has been shown to help optimize the immune response against respiratory viruses. including coronavirus.
Okay.
Making sure you're getting enough vitamin C and vitamin E and zinc has also been shown to be helpful.
Okay.
Getting too much of these is not beneficial. The
Mm.
other thing that's worthwhile, I think you and I have discussed this, is the idea of forest bathing.
Forest
It's been
bathing.
shown that exposure to the outdoors, certain chemicals that are released by trees, particularly pine trees, has been associated with boosting the immune system. And again, I talked to you previously about using essential oils like the enoki cypress, which
Right.
has literally been studied. It's been tested as a way of helping to optimize the normal immune response. And honestly, I think doing things like wearing masks, getting outdoors, making sure vitamin D levels are adequate, it all makes sense.
Okay, two questions going back to that. What people are going to say, what is forest bathing? What does that mean?
Yeah, forest bathing. I mean, it's a term anybody could Google it and read more about some of the research. But basically, in Japan, it's been shown that they were the first ones that discovered that if people would go and spend 15 to 20 minutes or longer in a forest,
Mm-hmm.
that they would have an improved immune response. And so this came to be known in Japan, and I don't know the Japanese term, as
Yeah.
forest bathing.
And it's just being around the trees.
It's just being around trees.
around.
Exactly. You can
Okay.
keep your
You don't
clothes
have to
on.
hug them. You can just be around them.
Exactly. And you keep your clothes on. There's no washing involved, but you're bathing yourself in all the environment that's produced by a healthy forest. And then now, for those of us that don't have access to a healthy forest, there were some amazing studies that were actually done in Japan where they took, like for instance, stressed out medical students and medical residents that were stuck in the city. And they literally used essential oils like the one I showed you that are extracts from certain types of cypress trees. And they infused the call rooms of some of the doctors with these essential oils, and the other doctors weren't exposed to it, but they were all living in the city.
So I love that you're talking about this. So essential oils, I'm a user too. I love essential oils. And okay, so
and these are very specific essential oils, and that's why I'm saying that the studies were done with very specific ones. That something called an enoki cypress tree.
Okay, and people are going to say, are all essential oils kind of safe? And I don't think
you're
saying that.
No, not at all. And
you're speaking about this one specific oil.
Exactly.
And is it aromatically, like in a diffuser is okay? Would you suggest?
Exactly. That's how it was done.
Not ingesting it, not topically.
No.
Okay, let's get that clear.
Yeah. No. And it's good to make that, because one of the things from our discussions is that whenever there's no research, I'm the first one to admit it. But whenever we are interpreting research, people that want to put that into physical practice should be following the same guidelines in the study. And that doesn't mean you tweak it this way or it's going to be better or worse or safer. Yeah. If you're modifying from the original studies, you can't assume you're getting the same benefit or the same safety.
Great. And that oil, you said cypress, or what? It's a type of tree oil.
Yeah, it's a specific type of cypress tree that in the research studies they were using what's called an enoki cypress tree. I believe the spelling is Enoki. I'm not 100% sure of that.
So just kind of infusing that in your environment can help boost your immune system.
Exactly. And again, it makes sense from a practical standpoint that if you're trying to optimize or target the immune cells inside the lungs, that by breathing it in is the way you're going to get it to where it needs to be.
Wonderful.
So again, there's logic to the way the study was done.
Okay, this is great.
And again, there's logic because the way we're exposed to this virus is respiratory as well. So thank you for clarifying. This is not something you should rub into your skin or swallow. There's no data on safety or effectiveness that way.
And everyone, this is also just, you're a medical doctor, you're a reproductive endocrinologist, but consult with your own medical team too. I think we should make that clear.
Exactly.
Trying to get full information. Well, this has been great. Thank you so much.
Always fun, always fun. We never know where our
I
conversations
know, I
are
love
gonna go
it.
to. But I'll tell you, everybody that walks into my office, they always say, I love the way it smells in there. I said, this is the way it smells in a forest.
Totally. No, I love that.
Because I'm stuck indoors. I can't get outdoors. So I do this, I walk the walk.
Yeah, we're lucky to be in Colorado where we do have access to forests, but many people do not. So it's a great.
Yeah, I'm just stuck indoors seeing patients all day. So the forests are, I mean, they're within driving distance, but they're just not on my schedule.
Oh, well, I appreciate you making the time for these chats with me. I really do. So,
Well, you stay happy. And
thank you.
like I said, most important thing to patients, please be informed, make good decisions, and then accept responsibility for your decisions, and know that as healthcare providers, we accept what your decision is. We just want to help you make informed choices.
Exactly. Yes. If you'd like to submit some topics that you'd like us to cover, please reach out to either myself or Dr. Greene. He's at enhancingfertility.com. I'm at ivfmanifestingamiracle.com. So we're here for you and look forward to another clinical conversation. Thanks, everybody.